Hello, I'm Dr. Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. What I want to talk to you about today briefly is facet injections. Facet is spelled F-A-C-E-T. It is a term that refers to the small joints in the back of the neck and the low back and the thoracic spine that are on each side of the spine. So you have a symmetrical, so one's on the right, one's on the left, and each one of them can develop pain. The facet joints are synovial joints that have cartilage, just like your knee joint has cartilage, your shoulder joint has cartilage, and they can be subjected to arthritis just like any other joint. So oftentimes when you're having low back or neck pain, it's the facet joint that may be the culprit. So the treatment for that, right now there really is no facet replacement, although that's in the works, and that's a bit extreme. That would be surgery. One of the best options, in addition to all the other treatments that we at Preferred Pain Center offer with our pain doctors, physiotherapists, chiropractor, spinal decompression treatments, is our interventional pain treatments, one of which is facet blocks or facet injections. The injections can be done at the affected levels. So if you have arthritis at multiple levels, say on the right side where you're having right-sided back pain, it can be done at where L4 meets L5. That's called the L4-L5 facet joint. The injection is placed by one of our pain doctors, who, by the way, are board certified and fellowship trained. They do it under an X-ray machine called a fluoroscopy, and they will put the needle exactly into that joint and inject a cortisone, which is a steroid injection. There also will be some numbing medicine mixed in with that, and that injection may last anywhere from a week to 6 months. So the steroid that's injected will stay there for quite a while and slowly get dissolved, into your system. Facet blocks are the standard of care for facet arthritis with steroid injections. They can be repeated and continue to provide relief for you. And typically they're done at our center in conjunction with the other treatments that we offer to give you, the patient, the maximum chance of success. Facet injections are done both in the neck and the low back. If they work very well and then they eventually wear off, either they could be repeated or the patient can become a candidate for what's called radio frequency ablation, which is a fancy term. I have another video based on that procedure, but that can give much longer term relief. And that's where the little tiny nerve endings that supply the facet joint are heated up and they're cut and deadened, and they can be deadened for 6 to 12 to 18 months. Those will eventually regenerate and grow back, but that procedure can be repeated as well. That's the overview on facet injections. I'm Dr. Greene, CEO of Preferred Pain Center. The pain stops here.